Since the start of the pandemic, hospitals have been strained to keep up with the number of patients.
For rural hospitals, it isn't getting any better as a number of issues are pushing them, well, they say to their limit. Channel 8's Macy Meyer talked with the Rural Hospital Association and has more in our top story tonight. Macy?
A lack of beds and a staffing shortage is making things harder for not just patients, but hospital staff as well.
Our rural hospitals are facing a lot of issues right now. We're 18 months into the pandemic, and along with our urban counterparts, we're seeing a lot of the same burnout and just a lot of the same nursing shortages.
Across the state of Nebraska, COVID cases are on the rise once again. It's putting a strain on rural and major hospitals since they're all interconnected. Rural hospitals turn to places like Bryan Health, CHI, or UNMC when they have a critical care patient that might need a little more help. But those major hospitals are seeing the same influx of cases, forcing patients to wait for care.
It's becoming a challenge to be able to move our most critical patients to the places that they need. And when we can't move our most critical patients from our critical access hospitals into our regional and tertiary centers, that means that other patients, there just isn't going to be a bed for them.
On top of that, many places are seeing staffing shortages. Even if a bed may be open, there aren't enough nurses to take care of the sick.
We have some hospitals that are vulnerable in Nebraska where maybe they only have 1, 2, or 3 nurses that are not necessarily in surplus, but if those nurses were to get sick or if they decide to exit healthcare or their profession, those hospitals may be out of a service line.
Hansen said places are also seeing more patients who may have put off elective surgeries or preventative screenings over the last 18 months, putting more pressure on the hospitals. Hansen said he believes the way to help hospitals recover is getting the vaccine to help reduce the number of COVID hospitalizations.
All right.